Thank you for joining Continuous Learning with Bioguard. I'm pleased to introduce our webinar speaker, Dr. Everaert, a highly skilled veterinarian with over 20 years of experience. Dr. earned his Master of Veterinary Medicine from Ghent University in Belgium and has since become an expert in the care of exotic animals. He owns and operates Vet, a leading clinic in Lubbe, Belgium, known for its cutting-edge diagnostic capabilities, including being the first in the country to install a combined CT and in-house PCR. Dieter's commitment to accurate diagnosis and comprehensive care is comprehended by his ongoing professional development across Europe and the United States. He is also a seasoned lecturer and has authored several papers in his field. In addition to his clinical work, Dieter served as the president of the Flemish Working Group for Exotic Veterinarians and has been the responsible vet for Avian, Belgium's first hedgehog shelter since 2021. Today, Dieter will focus on infectious diseases in psittacines and effective strategies for their control. The talk will begin with a brief overview of Psittacine management, providing essential context for a deeper exploration of the health challenge these birds encounter. Please join me in welcoming Dr. Everaert.
Good evening to you all. Thank you for this kind introduction. As you can see, what I will talk about this day is preventive medicine in Psittacine birds. Of course, one big part of prevention is the management, so food and environment. Then we will talk a little bit about screening of feces, screening in the blood, and then the main part of this lecture will be about screening for infectious disease. And I will end this session with mentioning of some vaccines that are available for Psittacine birds. So for management, food is, of course, one really important part of the management. And also, according to me, it's a really important part to prevent diseases. According to me, I think prevention is better than a cure. So yes, I'm quite convinced that even or especially for veterinarians, talking about food and diet is a really important part of your consultation. So for the food, if we look at the components of the food, in protein, there are 10 essential amino acids. So it's lysine, lysine, methionine, phenylalanine, threonine, tryptophan, isoleucine, valine, arginine, and histidine. Some typical diseases you can see or problems you can see with low lysine, you can see a feather depigmentation, so the coloration is gone in the feathers. One of the things you can see with low arginine is feather picking. I'm not saying that all feather picking birds are because of a problem with low arginine, but it's is one part of your differential diagnosis. So how much percentage of protein is necessary in the diet of Psittacine birds? Let's say between 10 and 13%. So another really important part of the diet, of course, is the vitamins. As you all know, we have the fat-soluble vitamins and the water-soluble vitamins. So for fat-soluble vitamins, two really important vitamins are vitamin A and vitamin D. Vitamin E, there's a precursor, beta-carotene, that's available in quite a lot of vegetables, but the problem is that it's really low in seeds. So that's why it's really important to give more than seeds in the diet of any Psittacine bird, but I will come into that later. So what you can see in birds having shortage of vitamin A is a hyperkeratosis of epithelia, mainly in the guts, but also of the beak and stuff like that. And what you see quite often is that they got secondary infections like aspergillosis. Another fat-soluble, really important vitamin is vitamin D. Vitamin D is essential for the calcium metabolism. Vitamin D you can get from your food or, of course, from the sun. That's why we advise all birds in-house giving a UV bulb so they can get UV light and they can make their own vitamin D from vitamin D precursors. The most important thing you can see with vitamin D and so calcium shortage is tetany. It's really common disease in African greys, especially those African greys that only eats the sunflower seeds. Sunflower seeds are really high in fats, but really low in calcium. So because of that, they can get hypocalcemia, and a hypocalcemic tetany is quite often in Psittacine birds and especially in African greys. So for the water-soluble vitamins, as the vitamin C is not, the birds can make their own vitamin C, but when there is a liver disease, there can be a shortage in vitamin C. So in diseased birds, it can be a profit to give extra vitamin C's. So for saying what the diet is composed. So seeds, a problem with seeds is that they're high in fat and low in protein, so really low in lysine, tryptophan, and methionine. And as said before, they're also low in calcium. So if you want to give a seed diet, it's really important that you supplement it with egg, food, sepia, vegetables, and fruit. You can give almost all vegetables and fruits. Only thing to remember is that avocado is toxic food for all birds. So it's really important never to give an avocado to a bird. I'm not really a fan of giving seeds because, as you've all noticed when you see birds eating, they're quite picky eaters. So they're gonna choose which seeds they want to eat and which not, and they mainly choose the high-fat seeds. For instance, if you have an African grey and you give them a mixture of sunflower seeds with other seeds, of course, if they eat all the seeds and vegetables and the egg food, yes, it's a complete diet. But what a typical African grey does is that he picks only the sunflower seeds. And if as an owner you don't see it and if you just keep giving more food because you think it's empty, then they just pick up only the sunflower seeds and they will get problems with vitamin and calcium deficiencies. So we really advise giving a pelleted diet or berries, so Nutri-Berries. The main advantage of giving something like Nutri-Berries is that there are seeds in it. So Nutri-Berries is composed of seeds, dried vegetables, vitamins, and some pellets. So, but for the animal, it looks like a seed because there are seeds in, but if they want to eat it, they need to eat it as a whole. So it means that they eat the seeds, but they also get in the right fruits or vegetables and the pellets. So that's a more complete diet. Another different advantage of giving the Nutri-Berries is that it's really more time consuming to eat, and it's more natural because they need to pick it up and eat it like that. So for lorries, they're nectar feeding, so you really need to give nectar feed. If you give a lorry like a seed diet, they will definitely get intestinal problems. So here are some of the the brands of food you can give. Of course, there are quite different others, but for the Nutri-Berries, I don't know other brands. So what we give is the Lefebvre. We really love giving the Harrisons because they have like a high potency and a maintenance food. The high potency you can use to divert the food from the seed diet to the pelleted diet, and then if they're used to eating pellets, you can go to the maintenance food. Also, what is really good is that the maintenance diet is really good for cockatoos. The problem with cockatoos is they're quite susceptible to obesity. So you need to give a food that's lower in energy, lower in fat. So for that, the maintenance food of Harrison is a really good one. So another problem you can see with food-related disease is an iodine deficiency. It's quite common in Budgericars, and it's giving a goiter. So it's a problem with the thyroid. In this picture, you can see a really scruffy bird with a goiter, and that's typical of iodine deficiency. Iodine you can just add in the water, so we don't see it that often anymore, but still you need to look at it. So another part of management, of course, is the environment you put them in. A cage, really important is for cages, is that you use stainless steel cages. Coated cages, they're quite often coated with zinc, and it can cause zinc intoxication. So you really need to look into that. Another problem, I think everyone has heard of it before, is the Teflon intoxication. So when you're cooking food with a new device, you can get Teflon intoxication in birds and they just fall dead. Also really important is don't smoke in contact with your bird, because all birds are really susceptible to smoke intoxication. Also, another thing, I'm not a really fan of the bird scent as a bedding, because it can give a dust and they can inhale it and it can give problems. Other problems management related are the purchase. If you have bad purchase, like really thick with salty coating, they can get a pododermatitis from it. So what I advise is just go to your garden, take some branches of wood, like the typical tree branches, and that's really good, because when they sit on a irregular perch, they're less likely to get pododermatitis. For hygiene, of course, really, really important. The first part of cleaning always is the mechanical cleaning. It's completely useless using a disinfectant in a dirty environment. So first thing you need to do is a mechanical cleaning, and afterwards you do a disinfection with either hypochloric acid or quaternary ammonium derivatives. So for yours who can get it, the F10 is really a very good disinfectant. Also hypochloric acid, if you can get it, that's also really, really good. It is good against viruses, bacteria, and even fungal infections. So if we want to start then preventive medicine, what are you going to do? First thing is screening of the features. Every bird, when they're been for 10-15 minutes in the waiting room, you can get a feces sample. You start with a wet smear. In a wet smear, you can look for giardias, really small one-cellular objects moving, and then you know it's a giardia, or macrorhabdus, or megabacteria. The macrorhabdus you can see on a wet smear. I mainly make a coloration with a diff quick coloration. I think it's more easy to see them, but even on a wet smear you can look at them. So the next thing you do with a feces sample is doing a flotation. You look for worm eggs, especially ascarids in Psittacine birds are really harmful. So you really need to look into it, because depending on where you live, of course, there can be contact with wild Psittacine birds, and there are quite a lot carriers of ascarids, and ascarids are lethal in Psittacine birds. So what else can you do with the feces? You can do a gram stain to look for the combination of gram positive and gram negative bacteria. So other screening parts is that what you can do is just a complete blood count, and really interesting thing in birds is doing a protein electrophoresis. You can see you can of course not diagnose a disease with electrophoresis, but you can really suspect some kind of disease just by looking at your protein electrophoresis. So then the main part of this lecture is the screening for the infectious disease. Okay, you can say it's not a real preventive thing, but still it's some kind of prevention, because if you know that a bird is a carrier of one of those diseases, you can treat them before they can get sick of it. So that's why I think it's a main part of prevention too. So which bacteria and viruses and fungal infections we're going to look for? We can look for chlamydia or Chlamydophila psittaci, also known as psittacosis. Mycobacteriosis is also a really important bacteria. So other bacteria, Mycoplasma, and then we go into the viral infections, polyoma, PBFD, Pacheco virus, Borna virus, and PMV3 are really important diseases in Psittacine birds. And then, of course, also aspergillosis. It's a fungal infection, but it can also be a quite big problem in birds, especially in Psittacines. So for the screening of chlamydia or Chlamydophila psittaci, why would you do it? Not only because the bird can be sick for chlamydiosis, but also it's a zoonosis. It's known as psittacosis. Cockatiels are quite often carriers, so it means cockatiels aren't sick at all, but they can transfer the disease to humans or to other Psittacine birds, or even not Psittacine birds, so to other birds in the whole. I think every cockatiel needs to be checked for chlamydophila. So how can you see that a bird is sick because of chlamydophila? There's a typical respiratory disease. How do you see respiratory disease in birds? The breathing is heavier. Typical thing in respiratory disease in birds is the tail whipping. So if in normal breathing, tail shouldn't move. If you see tail moving in a bird, it means that the respiration is too difficult. So for the diagnosis, you can either do it by serology or PCR. Serology it will be positive 15 days post-infection. And after treatment, it will be negative. The problem is not in many labs it is available. So what we mainly do is PCR. You can take an oral swab that's positive 5 days post-infection. Cloacal swab or feces, it's 10 days post-infection positive. In blood, is 15 days post-infection positive. And of course, also it's negative after treatment. So I think for this one, in-house PCR like the Q Mini is a really, really nice thing to have. We screen almost every other day for psittacosis in our clinic. So if they're positive, even if they don't have signs, it's really important to treat them, even if it's not for the bird itself, but just to make sure that they don't infect humans. So treatment of choice is in birds is doxycycline, and it's not only in birds but also in humans. So take care if you're getting sick and you have a bird and you're not healing by the typical antibiotics they give in humans, like the amoxicillin clavulanic acid. Tell your general practitioner that you have a bird and they might have chlamydia. I have seen at least 3 people who were sick because of chlamydia, even one who was hospitalized. And the problem was that they always give amoxicillin clavulanic acids, and it doesn't work against the chlamydia. So I even told one general practitioner, just give the doxycycline, and the one that was hospitalized, the owner that was hospitalized 5 days later, was cured. So it's really an important thing to think about. So another important thing, another important bacterial infection in birds is mycobacteriosis. In birds, we mainly see Mycobacterium avium and Mycobacterium jenafensi. The main problem with mycobacteriosis is that it has a really long incubation time, and it takes quite a long time before the bird gets sick. Another problem of the mycobacteriosis is that it gives quite a lot of atypical signs. It's typical bird that's not in a good condition, but you don't see really typical things from it. The problem too is that the mycobacteria is quite difficult to culture. So for diagnosis, most important are PCR or ELISA. At the moment, there's no good treatment for mycobacteriosis, and because it can be a zoonosis, mostly it's not advised to treat. You can try with erythromycin, but as said, I don't advise it. So a very, very common disease in Psittacine birds is the polyoma virus. So we have the Avian polyoma virus, or APV. It's a typical disease in nestling budgerigars and young parrots. It's even like that they divided in budgerigar fledgling disease and not budgerigar polyoma infection. In budgerigar fledgling disease, it's quite typical. You see the paracute to acute death of the pre-weaned birds, And in chronic cases, you can see the typical French mold. As you can see here, it's a typical French mold where the feathers are not grown normally. What is the difficult problem? All old birds are quite resistant to infections, so they're carrier of the disease, and they will and can give it to their birds. For avian polyomavirus, if you have a breeding colony with avian polyomavirus, what you need to do is you test all adult birds. And the adult birds, you stop breeding with it. Of course, if they're really valuable, you can try to breed, but it's really important to make the stress as low as possible, because stress is a typical thing that that makes the polyoma shed more in your bird. In the US, there's a vaccine available for polyoma. In Europe, for sure, there is no one. Not sure if there's one in Asia. I couldn't find it. So, but the only one I really know is the vaccine of in the United States. For diagnosis, you can do a virus neutralization assay. And the good thing is that antibodies remain latent for a really long time. So even in just carriers, the antibody tests will be positive. So really more interesting, because virus neutralization is not possible in every lab. So what you can do is an in-house PCR, as said before. The Q Mini has a primers too for polyoma virus. You can do oral swab, cloacal swab, or blood swab. The problem with blood is that there are more false negative. Of course, in breeding colonies, when you do an autopsy, you see the typical hemorrhages and a pale liver. If you do histology, you can see the intranuclear inclusions in the liver, in the kidney, in the spleen, and in the heart. So another really, really important disease in psittacines is a PBFD, or Psittacine beak and feather disease. Beak and mouth rot is called. It's a circovirus. It's mainly the Australian birds and that are affected. There's another variant that's only in the lorry birds. Typical disease of young birds. So what can you see in young birds? Abnormal feathers, beak lesions. So the beak can just be really in bad condition. And what is the main causing of that? It's because it can cause an immunosuppression. So how can you differentiate between a feather-picking bird and a bird that is a diseased bird? In a feather-picking bird, normally the head will be just normal and with normal plumage. Of course, if it's a feather-picking bird, if it's the companion that it's picking, then it can be also, they can also have a bald head. But if it's themselves they doing it, it's typical what you see is that the plumage on their head is normal, and everywhere else it's bald. If you see a typical bird like this, bald on the head too, most of the time, indeed, it's a PBFD. So what is really important to know, that the virus is really resistant in environments. So meaning it's quite often we see there's one bird infected in a show or in a store, and they shed virus by their plumage. And the plumage dust can be infectious for quite a long time, and that plumage dust can be a cause of infection in other birds, even weeks or months later. Another important thing is that lovebirds are quite often positive, but they quite often don't really get really problems. They're not really diseased from it, but the problem is that they can shed the virus, and the virus can like that go to other birds, and the other birds can get really diseased. So for diagnosis, for sure in PBFD, my first goal is doing a PCR in feather or bloods. They're positive 7 to 14 days post-infection. If you have a positive bird, but that's not diseased, I always advise retesting after 3 months, because PBFD can be a disease they catch when they're young, and their immune system can clear the disease. So not every PCR positive PBFD bird gets PBFD. Serology is of no practical use because the antibody titers in diseased birds are really low. So another important viral infection is the Pacheco virus. It's a herpes virus. It's causing internal papillomas, oral, cloacal, or papillomatosis. And the other thing it's causing, it's a viral hepatitis. And it's mainly the viral hepatitis that's causing really illness. Amazon birds, macaws, and conures are really susceptible. So in hepatitis in those species, always be suspicious of herpes virus. There are 4 different types. So what do you see in a diseased bird? Yeah, of course, in the end stage, it can be lethal, but typically you see diarrhea and yellow rates. There's a typical vertical transmission in birds. So that's one of the only viruses where there's a real treatment for. So the acyclovir at 80 milligrams per kilogram 3 times daily, or 400 milligrams a kilogram food can be your treatment in groups. As said before, vaccines for Pacheco 2 are available in the US. So how can you do the diagnosis? Like before already mentioned, PCR. PCR in blood is quite low. So I advise doing a cloacal or oral swabs. They're more positive. So in the Q-mini you can do it too. Serology is quite difficult because, as said before, there are different serogroups, so multiple assays need to be carried out, and it will be time and cost consuming. So in a diseased bird, what do you see? You see hepatomegaly, splenomegaly, and rhinomegaly. You can see intranuclear inclusions. You can see those here and here. They're quite typical intranuclear inclusions in liver, spleen, and pancreas. So how do you diagnose Pacheco virus or Pacheco disease? If you have a positive PCR and positive serology, yeah, then it's easy. It's a positive bird. So what do you do when you have a positive PCR but the serology is negative? What you do is retest in 4 to 6 weeks. It can be just that you have a very young infection, so their infection of a few days only. Then if you retest in 4 to 6 weeks, what you expect is that a PCR is positive and the serology is positive, or that they've cleaned it and that the PCR and the serology might be negative. But if you see PCR negative and serology positive, this means they're ill because of Pacheco, because they have antibodies against the Pacheco virus. So another disease in Psittacine birds, I think everyone who has ever treated a Psittacine bird knows about the Borna virus. Borna virus is known on quite a lot of different names. It's PDD, or proventricular dilatation disease. Why is it called like this? Because that's a typical thing you see in a typical ill bird. The proventricle is dilated. As you can see here in a contrast radiography, you can see that the proventricular is quite big. So another way of calling it is been known also before as macaw wasting disease. Why? Because it's been first noticed in macaws. It's like the name says, is a typical disease that makes the bird waste a lot of weight, and it's a typical bad bird. It's been taken quite a lot of time before they knew that it was a Borna virus. So it is like I said, it's an avian Borna virus, or ABV. Another name for it is neuropathic ganglioneuritis, because that's exactly what it's causing, and that's will be the cause of illness is a neuropathic ganglioneuritis. So all Psittacine bird, it's been described in all kinds of Psittacine birds, but especially macaws, as said before, macaw wasting disease, they're really susceptible, but also conures, African geese are very susceptible to it. At the moment, quite a lot of different viruses are recognized. So we see the Psittaciform Borna virus 1 and 2, and then we have Parrot Borna virus 1 till 8. So what do you see typically in a diseased bird? You see chronic weight loss, and this one, the undigested food, is quite typical for Borna virus. There's also regurgitation, quite normal when your proventriculus is dilated. Yeah, you see quite a lot of regurgitation. As said before, it's a neuropathic, it's causing a neuropathic ganglioneuritis. So you can see quite of different neurologic signs. Also, one of the things you can see is a PUPD, or polyurine polydipsy. So this is the typical stool of a bird that is diseased of Borna virus. You can see here all completely undigested seeds in the stool. So for diagnosis, PCR can be done, and then serology. There's an ELISA, and there's a antiganglioside antibodies that you can detect. This is quite a good one, because when there are antiganglioside antibodies, you know for sure that the bird is diseased. As I will later come into that, because sometimes the PCR is positive, but it's not really a diseased bird. So antiganglioside antibodies, if you see them, it's sure it's a diseased bird. So what can you see on autopsy? You can see a dilated proventriculus, myocarditis, and ganglioneuritis, mainly of the crop ventriculus and adrenal gland. So that's why also what you can do for diagnosis is take a crop biopsy, and then they can see ganglioneuritis, but of course it's quite invasive just for diagnostics. So treatment then for Borna virus, yeah, what we mainly need to do is diminish the inflammation. So there are studies using celecoxib and robenacoxib. There are some studies using meloxicam, but there are also studies that are saying that meloxicam can even worsen signs. So I'm not really advising meloxicam. I mainly use the celecoxib. What else for medication do you need to give? The cisapride is, of course, really important, because there is a problem with motility of the guts and the crop. So that's a really good thing to give. Omega-3, 6 fatty acids can be used and can be added at food because they have a really good anti-inflammatory process. Because it's a neural disease, gabapentin can also be used. So then the mycoplasma. Mycoplasma is quite often seen in cockatiels. Typical signs for mycoplasma in birds is conjunctivitis. Treatment of choice is tyrosine tetracycline or enrofloxacin perorally, and then eye drops with ciprofloxacin. What we also use is an aerosol with F10 because it's antiviral and antibacterial. So mycoplasma, there are PCRs, and the mycoplasma can also be cultured. For diagnosis, you can use PCR or culture. So aspergillosis, quite common in Psittacine birds. Why? Because of secondary infection. It's not a primary infection. Aspergillosis, you see it in a bird that, as said before, has some kind of bad management. So typical are the birds only seed eaters or even only sunflower seed eating. Diagnosis for itself, it's quite difficult. A definitive diagnosis you can do by endoscopy of the air sacs, where you see the plaques in the air sac. Serology in parrots is not possible, at least in the labs in Europe. I don't know for sure if in the US or in Asia there are some labs who can do it, but according to me, it's not really possible at the moment. Another thing you can use is galactomannan. It's a polysaccharide that is detectable in the blood when there's an active infection with aspergillus. Problem is, it's only when the aspergillus is growing. So in a chronic infection, galactomannan can be negative. But in an acute first stage infection, galactomannan is quite interesting to use for diagnosis. So PMV3 or Paramyxovirus 3, it's a typical disease in Neophema birds. It gives a central nervous disease, respiratory disease, diarrhea, and the main diagnostic thing to think about PMV3 is a pancreatic insufficiency. For diagnosis at the moment, there are no PCRs, but there's a hemagglutinin inhibition test. So for screening of antibodies. So as said before, which vaccines are available? So at least in the US, you have herpes virus 1 or Pacheco virus, and avian polyoma virus, killed virus, is also available in the US. So that was it for my presentation. I don't know if there are any questions. Okay, I can see here a question. A little bit more to go to the protein electrophoresis. I will try to share my screen again. Just a moment. Where is it? So if we go back here, this is a typical protein electrophoresis of a bird. So you have a double first peak, that's the prealbumin and the albumin, and then you have the alpha, the beta, and the gamma proteins. As you all know, alpha and beta are the first inflammatory infections response, and gamma is because of a chronic infection. But even that, there are papers saying that you can get a gamma peak in like aspergillosis. It's quite difficult to get into it. It's quite difficult to interpret, but if you do protein electrophoresis and you work with a lab that's used to do protein electrophoresis, they can help you with it. So I don't know if that answers your question. Okay. Next test. So if the ELISA is negative for Borna virus, we first always do the PCR. If the ELISA is negative, what you can do is you follow the bird up and you can do a recheck in a few weeks. Borna virus is quite difficult interpreting the lab results can be really challenging. So long-term experience and management of Borna positive parrots. Yes, I have a few. We treat them with celecoxib, with cisapride, with omega-3, omega-6 fatty acids. Depends on how far they already are in the infection. You can manage them for a few months to a year. I see a question here about the vaccine in Ghana. I honestly have no idea how you can acquire a virus, the vaccine in Ghana. I'm sure. Sorry. Are there any other questions? Yeah, I can see here a question about, have you been able to determine if Borna is passed through the egg? Yes, there are some studies saying that there's a vertical transmission. So not only a horizontal, but also a vertical transmission. But there are other studies that say it's not like that. So it's still difficult thing. Borna virus in every conference you go to where there's lecture about Borna virus, it's always a big discussion. So yes, there are papers saying there is a vertical transmission, but there are also papers saying it's not true. But I think it's quite good to be to be precautious and to think about Borna virus transmission to the youngs. So here's a question about the predominance of Borna in females versus males. There are no studies, according to me, that are saying that it's more often in females than in males. Yeah, might be indeed that the stress of ovulation makes them more susceptible to the Borna virus, but I think there are other things too that can relate to it. But it might be that indeed the ovulation stress can enhance the virus. Yes. Are there any other questions? You're welcome.
Okay, thank you, Dieter, for delivering an outstanding lecture. We also extend our gratitude to everyone who joined us today. We look forward to welcoming you to our next webinar. And good night.
Okay, thank you. Goodbye.